We are back with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider. She is answering your COVID questions. All right, the first one in the queue is plain and simple. Does the vaccine protect us from getting COVID? Yes or no?
It protects us from getting severe disease. And certain variants will have a decreased efficacy with the vaccines. So in terms of the Omicron variant, you need that third dose. You need that booster dose.
Okay, this person is asking if someone is due to get their booster vaccine in February, I'm guessing because they already had their 2 shots and 6 months from their last shot would be February, but they got COVID, a breakthrough case, in November. Should they still keep their appointment in February for that booster?
They should.
Okay. This next question is, if you had pneumonia during Thanksgiving season, but you are over the pneumonia now, are you okay to take the booster vaccine?
You are. I think as long as you're healthy, and it's important to go on and get your booster now.
Okay. And this person is asking, how long after you receive your booster shot does it take effect?
We estimate it takes anywhere from 10 to 14 days for your immune system to get that appropriate bump.
Even with the booster, not just the vaccine, but the booster as well?
That's right.
Okay. Okay, this person is saying, is the J&J still safe to get? I'm hearing several doctors are telling people to stay away.
So last Friday, the FDA came out with a warning on the J&J vaccine. So anybody that's had the J&J vaccine, we're recommending a booster. However, if you've had low platelets or a blood clot associated with it, then it's recommended not to get it. There's more and more data suggesting that the mRNA vaccines are much more effective against Delta and Omicron than the J&J vaccine.
I see. Okay. So this person is asking, what is the percentage or estimated percentage of people having serious adverse reactions to the COVID vaccine?
That estimate is, I think, is a little bit difficult to tell because there are a variety of adverse events that they track, and so some of which may not be in high numbers, but still bring up a lot of attention. For instance, we had the numbers of like pericarditis, the inflammation of the heart muscle with mRNA vaccines in young like teenagers and young adults. And then there's obviously the blood clots associated with the J&J, but I'm not sure what the total numbers are for the adverse events. All I do know is that we have had so many hundreds and hundreds of thousands of deaths, right? We've had 800 to 1,000 deaths due to COVID so far in the US, and I'm sure that number is greater. The safety profile is there for the vaccine, and we know it does protect against severe disease. So in terms of risk and balance it, like risk benefit, the benefit still lies within the vaccine.
Mm-hmm. This person says, how should I handle Christmas family gatherings when some of the family are against getting vaccinated while others have had all of their vaccine, including the booster? We are meeting at the home of a family who is against the vaccines.
That is I think probably a common description of some households and some families. It is very high risk to me if not everybody is boosted. So especially if folks are not getting vaccinated nor tested, and in times where Omicron and Delta are still very high in our community, I feel like that would be a very risky gathering.
Mm-hmm. This person is saying, if you had COVID and now you have the antibodies, do you still need to get vaccinated, and why?
So there have been many studies that looked at natural immunity. So when somebody's had COVID disease and they have antibodies, but it shows that even if you got just one more dose of the mRNA vaccine, that antibody titer gets really high and stays high and protects you a bit more than if you did not get that vaccine.
Mm-hmm. So this is a common question too. Are you safe if you are fully vaccinated and had your booster shot, but you found out you were around someone who tested positive?
You still should get tested. Again, the vaccine plus the booster protects against severe disease. And depending if it's Delta or Omicron, it's very important that if you've been exposed, that you need to be quarantined and tested to see that if you've converted or not.
And this person is wondering about how contagious you are and for how long. When do you stop being contagious? Like how many days after a positive test or you start getting your symptoms?
So that is part of the quarantine period, period and isolation period. So the thought is somebody who doesn't have any health problems is likely contagious anywhere from like 7 to 9, 10 days. So that's why it's very important to, like, if you're positive or if you have symptoms, to stay home and follow those isolation guidelines. In terms of data from Omicron, we still are gathering that information. We know that your symptoms show up sooner, right? And so that incubation period is shorter, but we're not necessarily sure how long somebody is infectious. We assume it's still the same conservative measures as the 10 days.